Hello everyone, welcome to my channel Ena England. I'm Croatian living in England and I make videos, many different topics. In today's video I am talking about one exam that ladies usually have. From the point of view of support. So other information about this specific exam you can get online. It's very much available everywhere, but from aspect of support so this is my point here and now. So I just want to give you some support. I went to my cervical screening myself, and it was a little bit uncomfortable. Just the idea of going to a hospital, the smell of a hospital, all of that just makes me a little bit, I don't want to be there, I don't want to be here. Yeah, so knowing that so many girls out there and ladies would feel the same, I thought, yeah, I'll just make this video just to chat a little bit about it. So when you come to that day that you need to go, that you feel more comfortable about the fact that you really need to go. Yes, it is a choice, nobody can force you, but it's a smart choice, I think. So yeah, if you feel a little bit anxious about it, if you feel a little bit scared, that usually comes from not having enough information about what's going on. So yeah, look at my hair, I just washed it, it's always like that, I have a lot of hair. So yeah, what can we say? It's an exam. You just go there, you meet a lovely medical staff, they explain you everything. Just the part when you need to show your private parts to somebody else maybe could be uncomfortable. Bear in mind, they see that every day, they are professionals. For them it's like your nose or eyes or your fingers, so that should not make you uncomfortable. It's just something they see every day. Why should you actually go to have your smear test? It's because if abnormal cells are detected in early stage, then everything can be fine. You have your little procedure and there's nothing to worry about. If you just leave it like that, with years things can develop into cancer. So why would anybody would like to take that risk if there is a medical help available? Yeah. So what I didn't know at the beginning is like, oh, if my result says abnormal cells, like, oh, am I finished now? It's the end of the world. But no, it's not the end of the world. It just means that you need to go again to see your doctor. And yeah, I have these two leaflets that I received. First one for my first check. So I will just read a few lines for you, so we can have a sense of what is going to happen and that everything is fine. And the only uncomfortable part is, for me, is just to be present there in the hospital, and the fact that you are in a hospital instead of maybe being on your sofa reading a book. But yeah, sometimes we need to do certain things for our health. All this noise I have here is because I have 3 kittens now with me. I'll show you. They are going soon because now they're too big to stay with their mommy. They have a new home. I'll show you the kittens. Maybe that will make you feel better. I'll show you in a second. Okay. This one is a baby girl. She is very affectionate. There she is. Go. And this is her brother, Ginger. It's raining today. Ooh, I'm glad I'm not working today. I'm home. That's Ginger. Just look at him. And look at this boy. Look at this boy. Oh, you want to go and play. He wants to go and play. Okay, where were we? Now let's go and read a little bit. So it is your choice whether to have a cervical screening test or not. This leaflet aims to help you to decide. After all, yeah, it's your choice whether you go or not. All right, let's see the other page. Oh, we have a picture here. Okay, what does it say? Cervical cancer happens when cells in the cervix grow in an uncontrolled way and build up to form a lump, also called a tumor. As the tumor grows, cells can eventually spread to other parts of the body and become life-threatening. So that's why it's important to go and check, and if they see anything that is abnormal, they can just remove it for you, yeah? Okay, let's see the other page. So what is cervical screening? Cervical screening, which used to be called the smear test, involves taking a small sample of cells from the surface of your cervix. The sample is sent to a laboratory and checked under a microscope to see if there are any abnormal cells. In my case, yes, they are abnormal cells. Have to go for another meeting with them, and then they will decide what to do. Abnormal cells are not cancer, but they could develop into cancer if they are left untreated. There it is. So there is no need to a panic mode, because if you do the right thing, these cells can be just removed. Depending on the result of your test, your sample may be tested for the types of human papilloma virus that can cause cervical cancer. As a next step, you may be offered another test called a colposcopy, which they offered to me, to look at your cervix more closely. In the person carrying out the colposcopy finds if the person carrying out the colposcopy finds abnormal cells, they will suggest that you have the cells removed, usually during another colposcopy. This is how screening can prevent cervical cancer. So the goal is just to prevent something serious as cancer. Okay, so here is another picture of what actually happens when you have a cervical screening test. This is what will happen. They will just take a small example and sent to laboratory. Right. Let's see what happens. Oh, let's see the statistics. So, 100 women have cervical screening, 94 have a normal result, and 6 women have abnormal cells. See, this is the statistics after the screening. So 4 women are invited for a colposcopy and 2 have no HPV infection. That's statistics. So after all, when you know enough information, then you don't have to be scared, or then you don't have to think what it is it dangerous? Yeah? So let's read something else. And then let's see what they say about colposcopy. A colposcopy is a test to see how much of your cervix contains abnormal cells and how serious these are. It is usually carried out in an outpatient clinic at hospital. A specialist will take a close look at your cervix using a magnifying lens and a light called a colposcope. I have a problem with this word. Colposcope. They may take a small sample to check any areas of your cervix which look unusual. If the abnormal cells are serious, you may need treatment to remove cells. This helps prevent cervical cancer. So, results should show that you have abnormal cells that should be removed. If you are found to have serious abnormal cells, these can be removed. This is also usually done during colposcopy in an outpatient clinic at hospitals, so right away there. So about half the women who have a colposcopy are found to have abnormal cells that need to be removed. Also, rarely, women will be diagnosed with a cancer. Cancers diagnosed through screening tend to be found at an early stage. Women who have early stage cervical cancers are more likely to survive than women with later stage cancers. So, for the reason that this is so available for everybody to go and check your health, and if necessary, to go visit your nurse and doctor maybe 2 or 3 times. You can get your help. It doesn't have to go to the stage of cancer, and you don't have to worry when you read that part, abnormal cells, which like, oh, what is abnormal? That freaked me out. So you don't have to worry about it, because statistically that's how things are. All you need to do is just to go and have your meeting with your doctor. So having a colposcopy, this is another leaflet that I have. We can read something from that. Image of your cervix. Okay, this is how it's going to look like. To have a closer look. Oh, before your appointment. Colposcopy is often carried out by a female doctor or nurse. If you want to make sure a woman carries out your colposcopy, you can ask. I don't mind. It's a doctor. If you think you might have your period on the day of your appointment, please call the clinic to arrange a different appointment. To make it easier to look at your cervix during your colposcopy, please do not have sex or use vaginal medication, lubricants, creams, tampons for at least 24 hours beforehand. You should take a panty liner to your appointment, as sometimes a small amount of this discharge can come out of your vagina after your colposcopy. If you have a small sample taken away, You may have some bleeding too. You can bring a friend, a partner, or member of your family with you if you want. All right. Oh, it's not that bad. It's not that bad. It's just that first moment when you receive the letter and that it says abnormal. That's what's scary. But after, you just realize it's not that bad. So what will happen at your appointment? There you go. They're looking inside you. You will have to undress from your waist down and lie down on a bed with your knees bent. You will be asked to place your legs onto some padded supports. Device called a speculum will be put into your vagina and used to open it gently. The nurse or doctor will then use a colposcope to take a close look at your cervix. The colposcope does not go inside you or even touch your skin, but stays about 30 centimeters or 12 inches outside your vagina. Oh, okay, that's comforting. The nurse or doctor will be able to see your cervix on a screen. The nurse or doctor will dab different liquids onto your cervix. The liquids stain any abnormal cells a different color so that they can be seen more easily. If the nurse or doctor finds anything unusual, they may take away a small piece of the cervix a few millimeters across. The biopsy will then be checked in the laboratory. So that's what they call a biopsy, that small piece of the cervix. The test itself takes about 10 to 20 minutes, so you will be there, lying there about 20 minutes. The whole appointment should take about an hour. That's because they are talking to you. For them, it's just a routine, and they will try to make you feel more comfortable. Yeah? Okay, nothing to be upset about. Oh, what does having a colposcopy feels like? The test feels uncomfortable, well, and some women might feel some pain. Well, it feels painful. If it feels painful, tell the nurse or doctor and they will try to make it more comfortable for you. After your appointment. Okay, most women, after my appointment, I know what I will do. I will make a cup of tea, I will have some popcorns, and I will just be under my blanket. That's what I will do. Most women feel well enough to go about their day-to-day activities straight away, but sometimes you may need to go home and rest for a while. You may have some brownish discharge from your vagina, from the liquids that were used during your colposcopy. For the next few days, you may have some light bleeding, especially if you have had a biopsy. This is normal and usually stops after 3 to 5 days. It is best to avoid sex, tampons, and any vaginal medications, lubricants, or creams until the bleeding stops. Okay, let's see about the results. The nurse or doctor may be able to tell you what they have found straight away. If you have had a biopsy taken, it will need to be checked in the laboratory. If this happens, you will need to wait about 4 weeks to receive your results by post. Don't worry, the results will come. You don't have to call after 2 weeks. Do I have a cancer? Do I have a cancer? Please tell me, where's my result? They will send you your result. Do not worry. Some women will have a normal colposcopy result. Okay, about 4 in every 10 women who have a colposcopy will have a normal result. If you have a normal colposcopy result, this means that your cervix looks healthy and you have low risk of developing cervical cancer before your next screening test. So you will be invited back for cervical screening again in 3 or 5 years, depending on your age, as usual. So in my country, you usually go to test every year, every 2 years. It depends on you. So here in England it's in 3 or 5 years, depending on your age. You can have a normal colposcopy result even if you had an abnormal result in your cervical screening test. All right. And this is the fact as well. Rarely women having a colposcopy will be found to have a cervical cancer. If you are found to have cancer, you will be offered treatment and care from a team of specialists. Cancer diagnosed through screening tend to be found at an early stage. Women who have early stage cancers are more likely to survive than women with later stage cancers. For that reason, it is important to be responsible and go and have your meetings with your doctors, even if it is not comfortable, because this way you prevent more serious things like all those cells having a party there, multiplying, right? I feel much better now. At the first time when I received my letter, I was like feeling a little bit down. I even didn't want to go there. But now, you know, when I spend some time watching videos of other girls talking about it, and that word abnormal is like so, it's just a common thing, happens all the time. I felt like, okay, everything is fine. You just need to go through this. Also, what happens is that you always have something arranged. For example, now I want to go to Croatia next month, and it can happen that I have to move dates to just be able to do everything. Yeah. Okay. What else can I read for you? Do you think this is comforting so far? Yeah. So many times in life, it's not about the news you receive, it's not about that things are serious and that they cannot be fixed. It's about how you feel about them, it's about how you deal with them. So that's why we should support each other always, okay? Yeah. Maybe I will make another video after all this is finished. Now, where I am now, it's just I had that first screening, that smear test, which showed that I have some abnormal cells, which probably need to be removed. So that's why they called me to have a colposcopy, and then they will see on the screen what they see. And me, myself, I will just go along, follow their instructions, do what is necessary. That's what I'll do. I'm not freaking out anymore. I feel okay. And lately, maybe 3 months, I noticed in my menstrual blood some changes, so I know something is going on that should not be going on there. So it looked like black currant jam. It's not like a liquid, it's more like a jelly thing, and my menstrual blood never looked like that. So even before I got my results, I knew something's not good, and I knew I need to go and see the doctor, right? Okay, so have a nice day, do what is right thing to do. I'll show you my kittens again. Yeah, everything will be fine, everything will be fine. We live in a century where you can have your health checked and you can have support, and everything is going to be fine, okay? Right. Here we go. Here we go. We're spreading love. Spreading love. You're such a handsome boy. Yeah, you are. You will have a new nice home. Nice comfy pillow and food. Yeah. Uh-huh. Yeah, he's looking at me. Yeah, that's true. That's true. Yeah, don't forget to carry on with your usual daily things. Some housework, going out shopping, spending time with your loved ones. You know, it's just one thing that's happening to you. Should not overtake your life. Oh, look at him. You little baby. Yes, you are. Yes, you are. Well, guys, thank you for watching. See you in another video. Don't forget to subscribe so we can stay friends. You can tell me your experience, comment down below. Bye-bye. Bye.